Hello, my name is Dr. MarkAlain Dery, and I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. You've seen me do these updates now for the past few months, and in conjunction with the leadership of the ACOI, I hope these messages are helping you to keep up with the latest on COVID-19. I know many of you are in the thick of the fight, and I'd like to thank you on behalf of all of us who daily focus on infectious diseases for a living, and certainly thank you on behalf of the ACOI. Moving forward, together with the ACOI, we will continue to share information as it becomes available, as well as some of the hopeful progress that we are seeing. Okay, so now on to the stories. So let's talk about COVID denial and Thanksgiving. All right. Now, I think it's safe to say that none of us have lived through a time like this. For those of us that are in healthcare, it has been an extraordinary, challenging time to manage this spread of COVID-19. But what's even more frustrating, however, has been the management of the spread of misinformation. Now, we've had over 250 deaths attributed to COVID-19 in the US alone, and that number is rapidly climbing, and it's hard to understand how there can be any doubt that this virus is real, yet that is unfortunately what we are facing. And in a recent in a recent set of surveys, Pew Research announced that over a quarter of US adults surveyed said that they believe that COVID-19 is the result of a conspiracy theory and that the virus was started intentionally. But a recent NPR report had featured a reporter in Montana interviewing random people that he had come in contact with, and what's even more mind-boggling is that some people believe that COVID-19 isn't any worse than the common cold. Listen, at least they believe that COVID-19 exists, right? It's also reported that in one Idaho town, my parents live in Idaho, it's also reported that in one Idaho town, the city council recently voted to table an ordinance requiring people to wear masks after 4 hours of heated debate. Wear your mask. It's not complicated. Look at this cool mask I've got here. This is the mask I wear when I'm outdoors, and when I'm indoors, I wear a 3-layer mask. All right. It doesn't seem to matter what public health officials were pleading for mask mandates. Elsewhere in Idaho, the Public Health Board has twice voted down proposals to limit indoor gatherings to 500 people. And with social media perpetuating these myths, confusion is escalating. In fact, did you know that misinformation travels at 6 times the rate that true information? How do we say true information? How do we even say true information? I can't believe I just said that. That information, that real information, travels at. So social media perpetuates these myths, and the confusion is obviously escalating because, again, misinformation travels much faster. The headlines are salacious. People are more likely to click on it, clickbait, what have you. All right, but the confusion isn't just frustrating, it's dangerous. Those who subscribe to conspiracy theories and myths, specifically about not wearing masks, are risking not only the health of all of us, largely due to the fact that they keep the virus spread alive, creating endless cycles of illness. And that puts more of us, healthcare workers, at risk. Denial is a dangerous disease that can hurt us and our families. I want to say that again because it's such a brilliantly written line. Denial is a dangerous disease that can hurt us and our families. Now we have Thanksgiving coming up, and I hate to think of all the groups who are ignoring the advice of the medical community and responsible government leaders who are asking people not to gather or to travel for Thanksgiving this year. The CDC is asking Americans to not travel and to not gather in large groups. Think about it. And I think I just heard on Friday, so that was the 19th of November, that 1 million people traveled, according to TSA. So the CDC is saying, please don't travel. As healthcare workers, we're telling people, please don't travel. And unfortunately, people are traveling. So again, the CDC is asking Americans to not travel. to not gather in large groups. I hope people will listen, and I hope that this video blog does make a difference, because last week I talked about how there are I talked about the U.S. being one big hotspot, and that means that a shortage of healthcare workers in one area can no longer import healthcare workers from other areas. And the need is everywhere, and I fear that over the next couple of days and weeks after that Thanksgiving will bring, it itself will be a national super spreading event. There's no question that we're going to start seeing over 200,000 cases a day, and we're going to likely be seeing deaths north of 2,000 a day, and it breaks my heart to even say that. So the CDC now, of course, projects that these newly reported COVID-19 deaths will increase over the next couple of weeks, as we were just talking about. And again, we are looking at very, very likely over 200,000 cases a day, which is just, it's mind-boggling to even say that. So one of the chief concerns, of course, is transportation, hubs where social distancing is very difficult to do. Think about waiting in lines to board planes, for example. And also the CDC reminds us that roughly 30 to 40% of COVID-19's transmission is driven by people who don't know that they have symptoms. So what does the CDC recommend? Again, limit Thanksgiving to those just living in your household, for the 14, specifically, and for 14 days prior to that. So if your college student is coming home, and or your son and daughter is in the military and they're planning on heading home, they should build in time to be tested and have those results on hand before coming to dinner. Of course, the PCR test is recommended. We're starting to recognize, as we've reported here on this video blog, that the rapid tests are likely, they're not performing well. They are not performing well at all. We are seeing that with asymptomatic individuals, that there are huge false negatives. The sensitivity on them are very, very poor. So please get those PCR tests. So other tips are to avoid potluck-style gatherings, and to try to hold your dinners outdoors, or to ventilate the indoor as well as possible where dinner will be served. You know, I saw a comment recently that unfortunately harkens back to the first Thanksgiving, which is bringing a deadly disease to people with little to no immunity is a very authentic Thanksgiving reenactment. So let's please not repeat history, and I wish all of you a very, very happy and healthy Thanksgiving moving forward. All right, let's just wrap up real quickly about COVID cleaning. We've talked about hygiene theater. We know that this virus is overwhelmingly a respiratory virus, okay? So stop microwaving your mail. If I hear people tell me that this is what they're doing, I was going to say I was going to put my head in the microwave, but that would not be a very smart thing to do. So I'm not going to do that. So lots of people all over the world have become expert cleaners. I like that. I'm an infectious diseases doctor. With antimicrobial solutions ready to attack the SARS-CoV-2 virus on surfaces, from hand railings to elevator buttons to shopping carts. And while it makes us feel good to think that we are creating a clean environment where we are minimizing the transmission of COVID-19, in actuality, we're not actually doing much to spread the transmission with all this incessant cleaning. The real risk, please hear me, the real risk is crowded indoor spaces where the virus is exhaled by infected individuals and where the virus lingers in the air. That's what causes the most threat. Now, there's nothing wrong with cleaning. I love it. But the problem is when people get a false sense of security. So how much cleaning are we doing? Get this. Procter & Gamble said sales of its personal cleaning products grew more than 30% in the quarter that ended in September, with double-digit growth in every region of the world, including more than 20% in Greater China. So that's good. Of course, I love making sure that everybody has clean hands, and if I never have to shake hands again, and if that means from here on out it's always fist bumps or elbow bumps, I'm very, very happy about that. So with that being said, are you ready for the next evolution of the ACOI? Go to the acoi.org to check it out, and stay on the regular lookout for these updates. And to read more from the sources used in this report, you can go to the acoi.org, acoi.org/ COVID-19 together with the ACOI. We will help you keep up on the latest information to help you respond to your patients and to stay on top of this crisis. And also, please, as always, feel free to reach out to me directly, madery@mac.com. Please stay safe. We can do this together.